Okay, good. I don't have to do too much projecting. The time is now 2:55, and I do realize that I am standing between traffic, costumes, candy, or cocktail hour. There you go. But please know that I have just a few slides to share with you, but they have a lot of information. We will be talking about eligibility updates as it pertains to where we were, where we are now, and where we are going. So I think as providers, as partners in the work that we do here at DCH, you'll find this information very helpful, because one of the things we want to happen at DCH is we want you to go out and spread the good news in terms of where we are, and also help our members stay eligible. That is the key thing here. And even if it's not eligible for Medicaid, we'll talk about some other opportunities and resources that as providers you can assist us with. Next slide. Now, I am contractually obligated to talk to you about our purpose, which is shaping the future of a healthy Georgia by improving access and ensuring quality to strengthen the communities we serve. And certainly as providers and partners in this work, you help us with our purpose. And so, again, on behalf of the Department of Community Health, thank you so much for making sure that we stay true to our purpose. Next slide, please. Now, if you were here early this morning, you heard our Medicaid Director, Stuart Portman, give to you our MAP vision, which is very specific. Stuart, as well as the other 4 Deputy Executive Directors, we sat in a room for 3 hours to come up with this. And so, of course, it is a member-driven payer of high-quality, cost-effective services through innovation and accountability to provide a culture of excellence. And so we think we do that every single day, or at least we hope we do that every single day, and we hope that you are part of that work, because we know in order to give high-quality services, you have to be in place as a provider. So again, thank you for that. Now, we've gotten all the pleasantries out of the way. Let's go ahead and stick to the business. Next slide, please. So let's talk about the current Georgia landscape of active Medicaid member enrollment. We, of course, have 2 buckets. We have fee-for-service, and then, of course, the majority of CMOs. And so, as of 10/1, we had roughly 2,246,265 members. But last year, around this time, we had 2,673,535. That's the difference of 400,000 members. That's a lot of people. We have heard all kinds of things in the media, all kinds of things even in social media, that we are just terminating people left and right. Now, what we have to do is make sure that members are appropriate for the Medicaid program. There's certain things, there's eligibility requirements. There's certain things that they have to do. And so that's how we got to the 400,000, because quite frankly, some people were no longer eligible for Medicaid. And that's okay, because we want them to move on and to go to whatever commercial product they so desire. If they move out of state or what have you, or win the lottery, because somebody won the lottery 2 weeks ago from here, whatever might happen, we want them to do it. Next slide, please. So this is the language that comes directly from CMS that basically was telling us that the continuing eligibility, the number that made the 2.6, actually ended in March 31st, 2023, and now it's time for states to get back to business. During the public health emergency, we had continuous enrollment. So once you were on, we did not do any redetermining, we did not ask you one question, we didn't do anything. We allowed you to continue to keep your coverage because we understood what was at stake if you lost coverage during a public health emergency. But then once the public health emergency was lifted, it was now time for us to mail out some things, make some phone calls, change some things in our system. And so that's what we have engaged in for the past year and a half. Next slide, please. And so Georgia had a couple of different approaches to this work. We call it a state-developed approach. We looked at all of the allowances that we were currently provided by CMS, and we developed an approach that we thought, or at least we hoped, would prevent improper terminations, mitigate any churn, because we know that sometimes members don't get a reaction, so they then do duplicate applications, they do all kinds of things. And so we wanted to make sure that we mitigated that. And then of course, if again, you're not eligible and you are ready to go maybe into an exchange or healthcare.gov or some other commercial product, that we allow that smooth transition to occur. And so let's go ahead and go to the next slide and talk about some of the things that we did. Now, one of the things, of course, is that we align medical assistant renewals with SNAP or TANF cases, as well as ex parte renewals. And so for those of you who are not quite aware what all that means, because it's a lot of acronyms and whatnot, so if a member receives SNAP or they receive TANF, and that information is correct, we use that information to help provide the Medicaid application. So that way, if you had already filled those things out, you're already good to go on the Medicaid side for the verification purpose. So we use that information, including income, to help us make your Medicaid determination. We reduce the workload burdens, including leveraging robotic processing automation. Now, this is where the member never received any notification. We knew that the information in the system was accurate. We went ahead, filled out the Medicaid application. It was like an automatic process, made the determination, no muss, no fuss. The member just received an update that they're good to go for another year. We also took the information from postal mail returns to assist with address validation. Now, I will tell you in all transparency, we've had a little bit of challenges there. Because of course, if something is sent out to you, and unfortunately the post office may not have been able to get it to you, it comes back to us as returned mail. That was a notification theoretically that you did not live there. But what we learned is that sometimes the post office would not, they would just put it in the mailbox or not put it in the mailbox or whatever happened. I think Randall and I were discussing this. And it just comes back to them, but you still live there. And so now we're talking about a false piece of information. And so we're currently looking at that to see what the impact there might have been within that 400,000 that I talked about earlier, to see where we can perhaps mitigate that. And then, of course, earlier this year, we utilized our CMOs, and we certainly want to thank them for that work, where they were able to do some updates through file exchanges. As they were providing the updates, as they were giving us information around the addresses that they had on file, we would then match that up with the information we had, and then that would trigger us to say, okay, we need to send something to this member to validate the information we have on file. DHS increased their staff numbers to meet the increased demand related to redetermination. Now, let me say this, and again, if you all have been in things with me, you know that it's always real talk with Rebecca, so I will tell you when something works and when something doesn't work or what have you. Now, of course, anytime you're increasing staff, it takes time for people to be trained. And so, of course, the average training time goes anywhere from 6 months to a year just to get people really on board with certain Medicaid applications. Now, unfortunately, I think even as some of you all are providers, sometimes it's hard to keep good help because they leave. So the minute they may come in, see the workload, because again, 2.6 million people had to go through redetermination, that scared a few people off. And so they would leave, and now you have to hire some new people. So there was a little bit of churn there with some of our workers. And so as we attempt to continuously get through these, we realize that there's opportunities for additional training, that there's opportunities to try to make sure that we keep the help that has been trained so that we can get through all of our redeterminations. And then also DHS opened 158 offices across the state this fall to allow more face-to-face interaction. Now, during the public health emergency, all of the DFACS offices were closed. They're now back open, but please understand you need to check the office hours. Now, 2019, it used to be 8 to 5 or 8 to 4:30. Those are the hours, Monday through Friday. Now, depending on the county, it may vary. They may be open for half a day, it may be every other day, it may be just Tuesday. So we want you to make sure that that is in your toolkit, that you understand when those offices are open. Next slide, please. And then the one that I like, and this was the very first initiative, going all the way back in 2022, when we knew we were coming toward the end of the public health emergency, the governor offered $350 to active enrollees of Medicaid, Peach Care for Kids, SNAP, and or TANF. Money in your pocket to update your information. And you see here what has occurred in terms of how many. But notice what has been sent. Notice how many people have taken advantage of it, how much has been claimed, and how much has been spent. Not quite equal, is it? So what that means is that some people, of course, they took advantage of it, but maybe they didn't follow all the way through and didn't give us all the information. We don't know. And so that leads to a little bit of disparity in terms of the information that we receive. And so we knew we had some work to do. But again, we have done several different things, and just by a show of hands, how many have seen the state-covered Georgia commercials? You've seen a peach or something that's telling you to update your Medicaid profile. I see a few hands here and there. Okay, all right, more hands, thank you. So part of that, this funding also was to help individuals get the word out. I think we initially started on public television. We had a couple of billboards and some other things. There were some outreach fairs and whatnot. But all of that is to get the information out, because a lot of people don't go to their mailboxes, and we'll talk about that a little later, in terms of making sure everybody understands that it is time to do redetermination. Next slide, please. So, what are we talking about in terms of the numbers? Now, in April of this year, the reason why it's not yesterday's numbers or anything like that is that this was the last time we did the true validation. We have to always make sure that we have clean numbers. So there is a little bit of a lag here. But in April of this year, we had 333,769 Georgians with Medicaid or Peach Care for Kids were due for renewal. That's what we have left out of that 2.6. At the close of the month, we were able to make a little bit of a dent, and you see that we're a little bit over 200,000 of these Georgians were renewed for Medicaid or Peach Care for Kids coverage. Now, 26% were found ineligible. For example, due to a change in circumstance or lack of response to our request for information. And so we're not trying to bother you. And so please make sure that your members, your clients, your patients, whatever you call them, when we send out a letter asking for information, we need that information for them to stay covered. Because what happens is that there's a timeline that's involved, and what happens if they do not respond by that timeline, they're terminated. And then what happens if they're terminated, they no longer have coverage, you can no longer provide services, or when you submit a claim, then that claim is denied. You don't want any of that to happen. Now, 2% of those individuals with April renewals remain pending and will retain coverage while their eligibility is determined. We did have a subset population that may have lost SSI coverage, and they went into what we call an ex parte status. We then have our Katie Beckett, these were mostly children, and then we have our Katie Beckett unit looking at these particular members to see if they are now eligible for Katie Beckett. And so finally in April of this year, 43,439 individuals were determined ineligible for Medicaid for kids based on their response to the state's request for additional data. And then finally, another 43,000 or so individuals were procedurally terminated again because they did not return information. And so that's very critical. And I know I start sounding a little broken record, but it's very important. Next slide, please. And so not going to bore you significantly about this, but you heard me say earlier that our CMO partners did a file exchange. We looked at the addresses they had, we looked at the addresses we had, and this is what we saw, where AmeriGroup had 8% different information information than what we have in our system. CareSource saw 6%, and Peach State had 19%. That's a lot of people when you think about it. And as most of us know, when we get ready to go to our particular providers, usually the first thing we ask when we go to the counter is they want to see your ID. They're going to ask you, is the information correct? You say yes or no, and then there's a validation process before you even go back and get vitals checked. But that was not occurring, and so our partners were able to help us identify those changes. And then, of course, with the address changes, some of them actually went in to the member portal and changed those addresses, and so when that occurs, sometimes that information does not sync up. Okay, let's go ahead and go to the next slide. Okay. All right, there's a bit of a lag. So here is the timeline that is so important. 45 days before the date of your renewal, you should receive something. Your members should receive a renewal letter or email if they opted in. Because I know some people, I didn't get an email. Well, are you opted in to receive an email? So that's a question that, as providers, we would love for you to ask. Are you opted in to receive updates about your renewal? But you would receive something in the mail. It's going to say DHS. It's going to have a little state seal on it. They need to open that up. A lot of people did not. Okay? And you want to keep track of those dates that's indicated on that letter. What is it telling you to do? Sometimes you get a letter that tells you you need to do nothing because maybe they were part of the automatic renewal. You get a letter that says we need for you to submit documents, income verification documents, things like that. You need to follow that information. If you have a gateway account, you need to go into the gateway system, load those documents in. Now, 15 days before your renewal or deadline, you will receive a reminder that your coverage eligibility decision is coming soon. If you have not, between that 45 days and the 15-day point, you have not done something, you're going to get that information. You're going to get that, hello, can you please give us this information again? And then we get to your actual renewal deadline. Paperwork is now due. If eligible, this will be your annual Medicaid renewal date. Let's say you've done right. You went to your DFACS office or you opened up your gateway account, loaded up the information in there. They have now reviewed it. This would be your eligibility date. Now, let's say there are a lot of people that they didn't open a letter, they thought something was spam, they didn't see a text message, or it went to a spam email account, or what have you. You have gotten nothing. We have not been able to get in contact with you. You didn't even know it was time. So at that point, 30 days after your renewal, you will be denied for coverage. And you can request a fair hearing. Because oddly enough, what we've also found is whereas people didn't get that initial letter at this point, they got the denial letter or the termination letter. Don't know how that happens, but, and I keep looking over at Randall because he, of course, is the Director of Member Services. Wait, Randall. And see, reluctantly he's waiting, but what's important here is that normally this is what we get. I have been terminated. Or we get from a provider, these people have been terminated, I can't provide services. Well, you got this information, but you didn't get this information. And we see a lot of that. However, a couple of things can happen. If a person has been denied because of, let's say they turned in the paperwork and there's some things there that maybe did not make them eligible for Medicaid, they have appeal rights. And that information is located on the letter as to how to file an appeal. Now, if they have never turned in anything and they have been procedurally terminated, then there's a little bit of grace period. And we will go ahead, keep the case open, and that way the member can go ahead and update that information for us. Now, again, until the bitter end. Because also go back in mind, think about what I talked about staff. Your cases pile up, so we want people to turn things in during the time frame that we've asked you to do that, so that we can keep an even caseload. Next slide, please. So, let's talk about the barriers to eligibility. As I stated before, member did not receive the notice. They had a change of address. Or we have heard, oh, I didn't know what that was, I threw it away. Oh, okay. What you want us to do? We don't know what to tell you. But that's a reason for you losing your coverage. Member did not understand the notice or forms requesting additional information to verify eligibility. Now, this is a learning point for DCH, because what we have found out is that the letters, even though some time ago we thought they were well constructed, we thought it had all the information contained there that you needed to know to do your redetermination, they were a bit confusing when the member opened it up. Very stressful, particularly those where a member may have also applied for SNAP or TANF or WIC or some other. And so we are in the process of updating what those letters look like, so that it is very clear as to your status, as it relates specifically to Medicaid or SNAP or WIC or TANF, and then whatever instructions you need to follow. And if anybody has seen those letters, it just has this particular member, this is the status, and then it just goes into some other things. There's a whole lot of little blocks on there, and people don't know what's going on. So that was a lesson learned for DCH, and we will be, and we're working with our DHS partners to clean up that. Member did not respond to requests within required time frames. We also talked about that. Again, remember what the time frames are. As soon as a text message or email or letter comes to that particular member, we want them to respond. We're also asking providers, and there are some other things I want providers to do, but we also want you to make sure that you are aware of when your members are redetermination date. Because that way you can help them, like, hey, I see your date is coming up pretty soon. Did you get a letter? And they can be honest and say, no, I didn't get a letter, or what does that look like? And we get a lot of those, particularly some in our elderly communities and things like that. They may not have seen things, and it's good to remind them. Eligibility workers are not able to process documents enrollees have submitted before cases are automatically closed. And as I talked about the workload, there are some automatic denials that can take place because the information has not been put into the system to keep the case open. So if it's just sitting there from a paper standpoint, the system doesn't know that it's sitting there from a paper standpoint. All they know is that there's nothing here that indicates that the member has turned in something. And because of that workload and because of that backlog, the member's case will close. We're also working on that to make sure that we're logging in the cases and the information. Member not reporting income or assets. We found out that there's a lot of rich and fabulous people on Medicaid.
You got that right.
All because they are hiding assets. But guess what? DHS has an electronic means of identifying assets. And so if that information does not match the information that you have reported, that's going to stop that case right there. And we're going to make the calls, and we're going to send the letters asking whether or not this information is true, and we're going to try to determine what information is correct so that we can continue with that eligibility determination. Not signing applications. I know this seems very odd, but for the paper applications, they have to be signed. If they're not signed, we don't know what we have. And we don't know if you're testing correctly to the information contained within. So that will delay your application. Not thoroughly completing the mandatory forms or screens. Screens electronically, if you're in our gateway system and we don't have that information, then that stops the case. It puts it in a pending status. We don't know what's going on with it. Same thing with the paper forms. If you're missing page 2 and 3 and you just go to the end, okay, they don't need to know all that, and all these kinds of things, that's going to stop your application. And the same thing with providing some verification, but not all. And then the other thing, as a matter of fact, I was just talking with someone about multiple applications. Nothing clogs up the system more than, well, I turned my information in, but I thought I'd go ahead and do another one. And so now we have 2 or 3 different applications for that person. Next slide, please. So let's say the member has provided renewal information. Now what happens? Of course, as I already stated, we're going to check all the assets and income as well. And we're going to make sure that we have what you have indicated on your renewal application. We're going to look at the current value of all assets beginning the first month of a Medicaid decision. We're going to look at proof of transfer of ownership, and this applies particularly to those that may be looking at some of our waiver programs and some other things. When you are attempting to say, oh no, I have no money, but then we identify that your $3 million home has just been transferred over to your daughter. We're going to see that. So no need to start down that slippery slope. That also includes things that have been, gifted. Oh, that was a gift from my grandma. Quick claim deeds, we know that happens a lot within the last 60 months, and that's the 5-year rule. Proof of all income, including any deductions and unredacted bank statements. Now, when we talk about unredacted bank statements, so when DHS asks for a bank statement, and we see 1 through 5, and we get page 2 and 4, and there's all kinds of information blacked out except for your money that you might have spent at Walgreens pharmacy, that's going to raise a red flag. And Randall is smiling because we looked at one a couple of months ago, and it was black, pharmacy claim, black. I think it was Amazon, or whatever. And so this member had been terminated or suspended, something like that, where they were, missing some coverage. And so Randall reached out to that particular member, had the conversation, I believe, to say, hey, we need the actual bank statements, clean bank statements, so we can see pages 1 through 5. We got that information. We didn't care if the person bought a boatload of pizza, which they did. They buy pizza a lot or whatever. That's fine. That's not our business. But we're just trying to make sure that there's no hidden income. And then proof of insurance policies. We also need that information, as well as health insurance premiums. And sometimes people don't realize, oh, I'm on a spouse's health insurance premium, but I didn't think that applied to me because I just need to get Medicaid. We need to have all of that information. And again, as a rule, any asset or income that appears through the verification process but not on the application will also need to be verified. Again, we're going to look at 2 things, what you submitted and what we've identified in the system. They have to match up. Next slide, please. So again, members on their own can confirm their eligibility. You can go in, make sure everyone understands gateway.ga.gov. If they don't already have an account, they can set up an account, and they can go in and see where their application, what's going on with it. Because we do realize going to a DFACS office or trying to call sometimes is going to be a lot. It may take a little time. And then, of course, to keep the active medical assistance coverage, have the current contact information with DFACS. Be aware, again, of the date that you come up, and it's annual. It is annual. Make sure we understand that. Pay attention to your notices, as we talked about. Does everyone know about the DFACS Customer Contact Center? Yes, no, maybe, not quite clear. That's the telephone number that you would call in case there is an issue. So please have that handy as providers. That's something that you can share with your members that you serve. Again, always be timely. If someone just loves paper, and we know that they do. Sometimes, particularly some of our elderly folks or people that don't trust, computers and all kinds of things like that, make sure you help them understand where they need to go in order to turn the information in. And then, as I stated before, if not submitted by the due date, be aware of the 90-day grace period after termination. So again, what can providers do? If a member is disenrolled for procedural reasons, know your member's eligibility dates and provide general reminders during the visits and encounters. Educate everyone on the appeal process. There should be things posted within your offices. Provide assistance if available to walk through the appeal process. We do have a lot of folks that already know what that process is to help the member understand, okay, you've been denied, let's make sure that you have filled out your appeals paperwork request and you've sent that in so that your coverage can continue. Member renewal pending, which is a lot of people sometimes, again, because of the caseload. Post notifications about the renewal process and timelines. Be familiar with that DHS website. Provide the contact numbers for your local DFACS office. I don't know if everyone had an opportunity to go into the vendors, but there was a DFACS table. Did people have an opportunity to visit the DFACS table? You should have picked up one of these. It's the map of all the DFACS offices, the counties in which they serve, and the individual who is the district manager as well as the deputy district manager. So if you need to ask a question or you're not getting something resolved at your local DFACS office, these are the folks that you need to reach out to. Then, again, provide the materials and remind members to update their contact information. The last bullet here is very important. If someone is using Georgia Gateway, please ask them to consider, and if they so desire, to opt into receiving text messages. That is one of the quickest ways to get information about your particular application. Because then once you receive that email notification, the text notification, then you have some information as to what you need to do. Next slide, please. And so the other thing, again, as we talk about Georgia Gateway, also, this is where all the offices are. This is also where all the libraries are. And remember I talked about paper applications? We also have libraries that have partnered with DHS where they will accept the Medicaid application. It's the same thing. So we want everyone to be aware of that. You can click on there, put in your county, it will populate where all of those library kiosks are, and that's a snapshot of the kiosk and what information they require. So you scan there, you can just put the information in there, and that way you know you now have something electronic on file as opposed to just having paper just sitting on a table somewhere. Next slide. Now, let's say, unfortunately, someone, maybe they no longer qualify for Medicaid as we know, traditional Medicaid. There's also something called Georgia Pathways, and you all should start seeing a lot of those commercials as well. Georgia Pathways to Coverage offers those that are eligible for it to sign up. Now, there are some qualifying activities around that. I'm not going to go through all of those, as I heard from a man here in the front. I'm between him and cocktail hour, so I don't want to take it. So we won't go through all those, but there are qualifying activities. Yeah, don't be touching your head right now. I call it out. So, and that includes work. That includes being a student. You may do volunteer hours and some things like that. And there's certain stipulations around it. But certainly we don't want anyone who may have at one point been eligible for Medicaid. They don't necessarily have the ability to get some traditional or commercial type insurance. Georgia Pathways may be an option. And they also had a table in the vendor section. Next slide. And that's just how one would apply for Pathways. Again, they can go through the DFACS office, they can go through georgiagateway.ga.gov and make that application. Next slide, please. And what else can we do? Let's say legitimately they're just not eligible for pathways or anything like that. Now, they may have the option to go to the state-based exchange. Now, it was formerly healthcare.gov, which was the federal-based exchange, but beginning November 1, which is tomorrow, it is set to go live. It has several options there for folks to purchase their insurance and move forward. Now, of course, coverage at that point will begin January 1, and there's also various stipulations around that. But those are some options where we can continue to help individuals stay covered. Next slide. Now, I know this is very foreign to some people, but this is the member portal when they want to report their changes with their address. This is on the GAMIS site. The member would go in, they'd log in on the portal, they would make the change, you see right there, request address or phone change, and they would hit the button and it would go right over, and we're done. And then there's some interfacing and some other things that happen. And Randall is looking, do you want to add something to that?
I think that's good.
Right, and that's what I'm saying. So there's two, and that's what I'm saying, there's some interfacing and some other things that would happen, but this is how you start the process. And again, is you receive an email confirmation to the address provided, and you'll also receive some additional information. So again, notice here, there's an email address, there's a phone number building. That's how we need to contact you to make sure that the information that was placed in here is you doing it, as well as the gateway folks can make sure that we have the right information. Next slide, please. So, if you were not aware and you have member issues, DFACS has monthly opportunities for providers to connect with them, to talk with them, to bring concerns to them. And this is the access code as well as the dates and times when they meet. And it's usually on Microsoft Teams. If you don't have Microsoft Teams, that's something you need to you can probably download or something like that. But there's opportunities where you can speak with someone at DFACS to discuss specifically any issues that you may be having with the members that you serve. Next slide. So let's talk about some coming attractions. For those of you all that are in the nursing home space, effective actually a few days ago, through June 30th, the requirement to conduct a telephone interview for nursing facilities has been waived. So, but bear in mind, that's only to June 30th, and it may go longer, but right now we want to make sure that we are getting those folks in and doing what we need to do. Now, please also bear in mind that the verification and documentation requirements are still being enforced, as well as other requirements for eligibility. So even though the DFACS worker may not conduct that telephone interview, we still need all the documents. Medical assistant provider portal updates. The provider portal will have a dashboard for nursing facilities and waiver providers to check the status of their members. We heard from you, we heard from the associations that you all need a way to make sure that all of your members that you serve in the nursing facility have coverage. And if they don't, then you can start the process of having the discussions, finding out what you need to do and getting the status corrected. And so we're looking at an implementation date of January 25th, 2025. So of course we have to update Gateway and get all those things together, and we're working on that. So we have heard you. Next slide, please. Another thing, if we have any gap providers in here, there is a service indicator. We talked about ex parte applications, and I already talked about those members that are moving, who lose their SSI, and then of course we want them to remain, so they'll be in that ex parte status while we continue to review them, perhaps for Katie Beckett. And then speaking of Katie Beckett, one of the things that we are so excited about is that we will be enhancing the application experience. So our families that have potentially have children that may go directly into one system, make the application, as well as provide all of the documents, upload, they can check, they can communicate with their caseworker about their application in real time. We're currently designing that. We hope to have that ready to go by March of 2025. Next slide. Okay, so I think we've covered just about everything. Of course, my final push, and I'll put on my other hat, is provider revalidation. Everyone in here that is a provider, you should know your provider revalidation date. If you have not done so, please go ahead and revalidate. Because if you lose your number is suspended, then of course you cannot bill. If that number then goes into a termination status, you really cannot bill, and we cannot undo that. And you would have to make application again. So just to make everyone aware of that. Any questions? Yes, sir.
Got a bunch of questions. Regarding the address thing, the Secretary of State's office uses, I think it's called the National Change of Address database from the post office to determine whether somebody's still a Georgian. So that might be a better source than just the post office return thing. The other one, let me see. Oh, you mentioned that providers, we should let our patients know when their Medicaid is going to expire. Is that the field on the eligibility screen on the right side? You know?
I know what our screen looks like, and I don't know, Randall, if you've seen it on maybe what the provider side is, but I believe so. It has redetermination date.
Is that's it?
That's it.
Okay, that's the one. Thank you. I'll start telling our folks that.
Great, thank you. Yes, ma'am?
To touch on what you were talking about with the redetermination dates. To touch on the redetermination dates, I had my team go run it monthly, but those dates are not accurate. And so I wanted to know, some of them for our members are, but we try to stay proactive in avoiding them losing their eligibilities, but it's hard to, some of them have redetermination dates back in the 1900s, and some will say 2019 or 2007.
And
so
what kind of
that's
provider? I'm sorry.
a private health care provider.
And you sure, and I just want to make sure, because all of those dates should be accurate. So, make sure that you're looking in the right spaces as redetermination date. And,
Yes, ma'am. I agree.
We had the same issue.
Yeah.
well, that sounds like you all need to be having a conversation. Let me go back to this. That's an opportunity to find out what's going on and what's not being updated and so forth. So I'm going to take that one back, and we're going to ask the question as to what's going on there. Randall? Okay. Yeah, but we can certainly take it back and see if there are just kind of some overall, similar to what Randall was saying, that SSI members are updated differently. And so if there are some issues there, we'll certainly put this in the FAQ that always comes out after the Medicaid fair. And if it's something that's aside from SSI, and there's some system issues and things like that, we'll certainly take that back to identify what the problems could be.
Thank you.
Thank you. In the back.
Hi, my question is about the renewal process. I know you said the duplicate applications will hold up the process, but after the renewal date, you have 90 days. So if you miss the renewal date and it's been 90 days, you now submitted the renewal, but you haven't heard anything. Do you submit a new application?
No,
But
not this
how long? Because if you don't, and then you don't hear anything from the renewal, now we're in danger of having some days that we're not going to be eligible for because we didn't keep the application timely. And we're not hearing back within 90 days.
Right, and that's when you need to be reaching out to your defect district folks to find out what's going on with those applications.
And we get the message is being distributed,
So,
or it's a delay. But then if we don't do
Does
an
the member
application,
terminate?
and then we get the denial, which is 6 months later, we can do it at then, but then we're gonna lose 2 months of coverage.
So it sounds like, because again, I think we're talking about a timing issue. So if you've gotten the application in within the time that you needed to get it in, well, the member has gotten it in, even with those 90 days, and you have to kind of stay in front of defects. That's why I went through, here's some numbers and some things like that. Then you should be okay. Now, you should be okay. Now, again, like I said, because of the workload, some things will just close out because no one has touched it. And the date of when they last touched it is now, past the termination date. We normally look at those and we can help facilitate that a little bit with DHS. We do work with providers. So again, I know people send me a lot of things and then I send it over, and I don't know if Bradley Green is in the room, or Mary Garrett, or any of those team members from DHS. We will send those over in mass so that those cases then remain open.
So what should our expectations be for the Medicaid application process?
So standard promptness in a utopian environment is 45 days.
So we're not there.
And I know, but we're not there. And so after that, it could be 60 to 90 days from the time that they actually receive it. Now, I will also say, ladies and gentlemen, that with our Hurricane Helene and all these other things, some of those applications got pushed back while they try to help those folks in those impacted areas. We did get that information from DHS. So, but please make sure that we know about it, that your district manager that's assigned to your area is aware of those challenges that you're having with those applications so that we can stay on top of those members.
Okay, so 45 days from the application date, we should be adding it to the OFI.
Right, and this is online, correct?
Yes.
Yes. Mm-hmm.
Thank you.
Thank you.
You got one more?
One more, okay.
My question was, I'm a nursing home, and with the renewals, what is the normal time frame for those to be completed and approved? If you sent all the documentation, because most of our residents have been there for years, so we send RFMS docs and their admission docs. So what is the time frame?
Same timeline.
It's supposed to be the same time frame?
Yes.
And I've been doing the, like she was saying, it's kind of piggybacking with her question too, with the nursing home Medicaid apps. I have some that I've done back in July. And I sent in the spreadsheet, and they still haven't been assigned to anybody yet. I've done fair hearings, I've done the second part, there's nothing being done. Is there anything else that
So
we
you've
can
done
do?
fair hearings on those that have denied?
The fair hearings are the ones that have gone past the 45 days.
Okay.
So is there anything else that we can do? I mean, I stay in contact with the case managers, because I'm Henry County, and we pretty much we email, we text, we call, we do all that, but they're saying their caseloads are so high, that's why they're bombarded. But like I said, I did cases like 3 months ago, and they still hasn't been assigned to any case manager yet.
Are those cases, and you're saying that they're all terminating, or are they still open?
They're still open,
Okay,
they're
if they're still
residents,
open-
yeah, the residents that's at the nursing home, but they haven't been assigned to any defects case manager to work their case to get the Medicaid approved.
Yeah, it's unfortunate, but they're trying the best that they can with the folks that they have, so. But we are aware, I think the main thing is we want to make sure that as you're communicating with your district manager assigned to your area, that those cases remain open so that services can be rendered and you can continue to get reimbursed for those services. Anything else? We have two more, and then
How far behind is DFACS in processing the Medicaid application?
I think our last check, it was roughly about 6 months.
And she's
So
about
again,
right.
very transparent, but yeah, it was roughly about 6 months, and unfortunately, these two statewide emergencies kind of continue to push things back. Yes, ma'am.
I have a question. When you were talking about, in 2025, that nursing homes won't need to do, an interview anymore. Will they also consider those transitioning from a nursing home to fee-for-service? Because sometimes they're in that limbo
population, if somebody's going into the waiver or something like that, no, that won't include that
Because they're
population.
still in a nursing home, so they don't have a phone for an interview.
Okay, but this is just for, you're in a nursing home and you're trying to stay in the nursing home. Then you don't have to do the face-to-face interview, not transitioning to a new program or out of the nursing home. Yeah. Yes, ma'am.
So I have a question on, a resident that I renewed the application for. We didn't get no feedback on, but if we check on Gainesville, Gainesville is still providing, it's still showing it's being paid. Should we mark them as being approved, or?
No,
we still have to wait?
don't do anything to it. You do want to continue to monitor that until you receive information whether or not they've been, do you have a new redetermination date?
No, it was just a renewal.
It's just, no, that's what I'm saying,
It's
it's just
a renewal,
renewal.
and we just never heard nothing.
You just
back
never
on
heard
it.
anything back,
But
okay?
in Gainesville, it's still showing like she's approved.
Okay, and then it's still being worked. All right. Thank you so much, everyone. Please make sure you fill out your surveys. Have a very safe evening and afternoon. If you have any questions, feel free to give me a call.
Yeah.